Hi everyone, here Dr. Franck with Cushier Plastic Surgery. We figured today we're going to talk about Mommy Makeover. What is it, sort of how does it happen, and what can we do to address it, and sort of what's the recovery like. Now, Mommy Makeover really relates to mommy, so pregnancy. And in pregnancy there is an expansion and a growth of mainly two areas in the body. One is the belly, right, because the uterus with the baby grows and it starts stretching the skin, it starts stretching the abdominal wall, it starts stretching the abdominal muscle, the rectus abdominis muscle, which is the six-pack muscle, and it sometimes even separates it a little bit. And then in the breast, in the chest, under the influence of progesterone and estrogen, the breasts grow a lot, for the development and proliferation of lactation and milk. And after pregnancy, all those tissues kind of shrink again and deflate, and that leaves that sort of overall slightly deflated appearance and sagginess of the tissue. Now, you can imagine if that happens with one, the body kind of recovers, but then, with multiple pregnancies, you have that effect over and over again, so the tissues overall just stretch out. Now, what can be done to sort of restore and kind of rejuvenate the tissue to its former state? So, one, there is obviously the changes with age, which we can only, do so much about, but in terms of tightening and sort of lifting the tissue again, we have plenty of options. Now, in the breast, it kind of depends what happened. If it's just sagginess or the breast kind of descend, then we can do a breast lift. If there's also an overall lack of volume, we can lift it and even augment it at the same time. And if it's just really a lack of volume for usually younger moms, then sometimes an augmentation is all that's sort of like needed or even desired. And then in the belly, or for the belly, it's just often getting rid of the excess skin and reapproximating that abdominal muscle. So then people talk about a tummy tuck or abdominoplasty, which is sort of part of a mommy makeover when we sort of talk about the belly. So you get rid of excess skin, potentially stretch marks, and reapproximate that muscle that potentially separated and leads to bulging in the midline. And all that will sort of give you a nice slimmer contour and restore some of that tightness that you had before. Now, in terms of recovery, it depends a little bit if you do only the breast or only the belly, or sort of both together, or even other procedures, arm or face, and all that together. But let's say in general, the recovery from any breast procedure is usually pretty quickly. Similar to our breast augmentation patients, we have them usually exercise or do certain arm raising exercise the same day. And if this combined with a breast lift, it might be slightly more extensive, but we're talking really just a few days of discomfort and soreness, and really almost no, impairment of day-to-day function. The belly sometimes feels a little bit more sore just because from the tucking and tightening of the skin, the tissue overall feels it's under stretch, and we say patients in general it takes about a week. Now, what are potential risks of the procedure? There are the general risks with any kind of operation. Every time you get surgery, which is sort of bleeding and potentially getting a local infection. But really more specific to those areas is in the abdomen. You want to make sure that you don't put the area under too much tension. Otherwise, there can be sort of small areas of delayed wound healing. And you certainly don't want to be a smoker. Or if you're a smoker, you really want to quit smoking for numerous weeks, because smoking impairs blood flow, and impaired blood flow means impaired healing, and that will lead to wound complications. And then the other thing is potentially having a little fluid collection that, if it happens, we can usually address on the post-operative visit by aspirating some of that fluid. It doesn't require any major operation. In the breast, it's just an overall recurrence of the sagginess over time, and those are really the main complications. Am I a candidate for the operation? So in general, if you went through those changes that I sort of mentioned and you're otherwise healthy, you are a candidate. You're a good candidate. You don't even have to have pregnancy. If you feel like that your breast got a little saggy or deflated just due to regular hormonal changes or aging, you're basically a candidate for similar procedure. I want to say that people who smoke are at an increased risk for pretty much every complication, and we make sure that every patient that we operate on is not smoking or vaping for at least 6 weeks. Now, a common question is, can I have children after the procedure? And the answer is yes. Neither of the procedures really, meaning the tummy tuck or the breast lift or breast augmentation, or both together, does prevent you from having children. I do say that with the tummy tuck, you ideally want to do it after you're sort of had children and you're done with pregnancies, because if you have an incision in the lower abdomen and you sort of go through pregnancy again, a lot of those results will be distorted and the scar might spread, and which might be less ideal. Now, what kind of scars will I have after a mommy makeover? It depends a little bit again on the procedures, but let's start with the breast. If you just have a breast augmentation to restore volume, you're going to end up with a tiny, few centimeters incision just hidden underneath the breast, which is pretty much inconspicuous once it heals. If you have a breast lift at the same time, there's usually an extension of a scar around the nipple, either in sort of an inverted T or lollipop shape, or maybe just a flamed line. Depends a little bit on the lift, and ideally you want to see a surgeon for that to get the exact sort of evaluation and an idea of where the scars will be. And then for the abdomen, there will be an incision, a lower incision, sort of similar in the level of where a cesarean section scar is, sometimes a little lower than that. And it will extend sort of almost to each pelvic bone on each side. And the idea is sort of to conceal it underneath clothing and underwear, so that once everything is healed, you really can't see anything. There will be a tiny incision around the belly button if the lift is so extensive that it requires the belly button to be reinserted in a new location. But even that one is fairly inconspicuous once it's sort of all said and done with healing.